Okay, thanks again for staying with us on TMI Monday. Of course, you know that the realities of COVID-19 is staring at us and our faces, and we need to do more than we are doing today at all levels just to ensure that we'll keep the virus at bay. All right, and one thing is certain. I saw in the presentation by Mr. Governor yesterday that the increasing number is expected to peak at some point. What that means, we'll look at that. And then in terms of funds allocation, in terms of spending so far to contain the spread of the virus, is also a major talking point. But I think the one that will attract attention to many people just now is the dusk to dawn curfew, which of course has now been imposed. But I think that should be a major starting point. Comrade Austin Osakwe is a member of the Edo State Task Force on COVID-19. Comrade, many thanks for joining us on the program.
Thank you very much. Good morning, viewers.
Okay, now let's begin our conversations on the broadcast yesterday with the dusk to dawn curfew. What does it mean?
Well, essentially, you know that the state has been under a partial lockdown. What that means is restriction of movements as much as possible. For those who must go out, the regulations are there. Observe social distancing, okay? Keep some distance between yourself and the next person. Where there needs to be a gathering for a meeting or any other such purposes, ensure that you do not exceed 20 in number while observing social distancing. The second is people are encouraged to have running water source. It's not, we need to clarify this. It's not a matter of just putting up a basin or a bucket somewhere. The water must be running water. So you wash your hands with soap and it runs off, okay? At every point, in the homes, in business places, in offices, in markets, and so on. And then, of course, you know that government has insisted that from level 1 till 12 should work from home. That essentially reduces the number of persons we have there on the streets. And then it's imperative that people put on their face masks when they leave home. That is also being enforced. But it was discovered somewhere along the line that in the evenings up till night, it's as if a whistle was blown somewhere that those who have been indoors all day should now come out in the night. The drinking spots are a beehive, you know, populated as never before. And that's a recipe for disaster, because you have clustering of people all together, talking, exchanging, you know, conversations, and of course that's disaster waiting to happen. And so in the wisdom of government, it was thought that a curfew, that is staying indoors between 7 p.m. till 6 a.m. in the morning. And in any case, wait a minute, didn't Jesus say that there is a time to sleep and a time to work? And he said there are but 12 hours in a day. All right? So from 7 p.m. to 6 a.m., it's already a time for people to go back home and rest and prepare for the next day's job. But this is essentially to curb the spread. People need to understand this. To curb the spread so that we avoid the kind of gatherings in beer parlors, in eating places, and all the other social gatherings at that period of the night. So it's going to be enforced. It's initially for 10 days, and enforcement is immediate because it begins today. So our advice is that people should not think that this is another round of jokes. It's going to be strictly enforced. The curfew is total. It's a curfew because you are indoors, you are not outside, between 7 p.m.
and 6 a.m.
And it's initially for 10 days. So by the 30th, 31st of this month, of course, the committee will meet again
to review
the situation. It is hoped that during this period, a lot of screening and testing will have taken place. In fact, government's plan is that during this period, as much as 500,000 persons will be screened and testing will be done accordingly.
Okay, let's also look at one major pullout from the broadcast yesterday, which talked about the numbers that is rising now, expecting to peak somewhere around June. What's the import of that?
What it simply means is that it's not yet uhuru. If we say we have not peaked, it means that we are expecting larger numbers. This is not meant to scare anybody. It's just being realistic. It's for people to understand that as screening intensifies, as testing intensifies, we are most likely to have persons who are out there who may not have shown symptoms, but who are already positive of the COVID-19 virus. So we are expecting that as testing continues, there will be more people. And this is going to grow. The epidemiologists are also giving counsel. Researchers are giving counsel. Medical workers are on it. So what the feedback that government is getting is that we need to realistically consider the possibility that there's going to be an upsurge. But it's not to scare anybody, but just so that we know where we are and where we are going. It's part of the regime of transparency and accountability with which government seeks to pursue this agenda.
Okay, there have been questions around expenditures and spending around COVID-19. I mean, the government in the broadcast yesterday talked about $1 billion or above $1 billion spent so far, and I know that tongues are start wagging because looking at what is on the ground, what are your perspectives? What are your views?
You know, when dollar and naira signs are put close to figures, those figures automatically develop a life of their own. So I can understand why in the social media and out there people are wondering. 1 billion looks big, but I can tell you from the vantage point of being a member of the response team at the state level and then having done facility tours to know what government has put in place, that 1 billion, people should just prepare to hear more billions because more will be spent. Now, I'll tell you this. When this whole exercise started, when it suddenly came up, there were no ventilators. There were just 2 ventilators in the state. The cost of a ventilator ranges from between 15 and 25 million. All right? There were just 2 in place. And as I speak to you, we have not less than 30 in the state.
30 ventilators?
Yes. I don't want to put a figure on what was bought, how much was bought. Yeah. Just to give you an idea of what government must have put money into only at that level. I have had a facility tour of the isolation centers at the Stella Obasanjo Hospital, for those who are familiar with the place, and you can go there and see it's open. At the time I visited, one isolation ward had just been completed with beddings, with all the gadgets that you need for this intervention.
And there are people inside, or there are people not yet inside?
Well, at that time, people were not inside. Okay. It's now that you have referrals. At that time, another one was being built closely. And within 12 days, that one was finished. It was furnished, and all the equipment put in there. I visited the one by the Sickle Cell Center. These are areas that people can go and verify. The building there was dilapidated. Government had to reactivate that building. And as I speak to you, it's ready for use. That's just at the level of building infrastructure and the purchase of equipment. I'll give you another area. The government announced that an insurance cover has been offered to medical workers.
On the front line?
Yes. There's premium. So if you are paying premium on insurance for thousands of health workers, now you can easily fathom what that will run into. over 4,200 staff have been trained for this exercise. That's cost. Remember that before donations began to come in, government had spent no less than 200 million to source for food from all over. There were, in fact, before interventions began to come, government had already filled 5 warehouses of food. And the government has mentioned that what has happened so far is the first phase of distribution of palliatives. There will be a second stage coming. And of course, donations are still coming in. So the point I'm making is that when you hear, the government could easily have gone on in that address without mentioning any figure. But the regime of transparency and accountability, that from stage to stage, the people should know how gargantuan the battle is, and that government is taking from limited resources to fight this scourge. So essentially, money has been spent, and I'm sure much more will be spent.
If you just join us, it's TMI Monday, reviewing the broadcast by the state governor on the level of response to COVID-19 in Edo State in recent times, and then projections into what is likely to come in the days ahead. It's a collective responsibility, as I said before, just for us to make headway in ensuring that we sustain the fight against COVID-19. One major aspect that has been of concern to people is the level of response at the rural level, at the community level. What are we doing in that direction? What's your assessment of efforts in that direction to ensure that this message is also carried down to the grassroots?
I have mentioned before now that whereas you have an omnibus committee, there are subcommittees handling different areas. There is a subcommittee on communication per se. Enlightenment falls squarely into that. Recognizing the peculiar nature of rural societies, town criers have been mobilized. In fact, we call them town announcers because we don't want them to keep crying. So you have town announcers at different community levels who go with megaphones. They also have messages scripted in the indigenous languages of those areas that they are covering. We have jingles in Afema, we have jingles in Ishan, we have jingles in Benin, Onwa, and so on. So as they go around, they are announcing to the people and educating and enlightening them. It will interest you to know that before this advent of town announcers that had been dispatched to these communities, there was near zero awareness level about the COVID-19 scourge. So, but we are getting results that awareness is rising. Then there are health educators who are closely working with these town announcers. What those ones do is to dispatch their people into groupings, into local governments, into wards, into deeper communities to educate the people not only on the reality of the COVID-19, but also to teach them on these regulations, to explain to them on these regulations. It's easy for us in Benin here to just say hand sanitizers. Some of these people in the rural areas may never have heard of them. So this is the work that town announcers and health educators are doing. And I'm talking of covering the 192 wards in Edo State. All right? So all of this is going on and awareness is rising. We're also using traditional institutions. You know that in rural areas, the age grade meetings are still very strong. So we are using all of those to disseminate information, to educate the people. And traditional institutions are holding meetings, women groups, farmers groups, youth groups, and so on. So there's mobilization. I even think that at the rate we are going, the rural areas are likely to even have more information and therefore are better prepared to fight this scourge than certain settlements in the urban centers.
Let's quickly talk about sustenance of livelihoods, particularly at the rural level. What is government doing in that direction? Because, you know, this time, this period that we're in is supposed to be the farming season. And we know that as a result of the COVID-19, particularly in the urban areas, movement is restricted. In the rural areas, movement is also restricted. Wouldn't this add up to bring about farming in the days to come, maybe looking at the national level, even at the global level?
You know, we have had more challenges restricting movement in the urban centers than in the rural areas.
Okay.
You know that because of the sheer concentration of population, the density of population in urban centers, restricting movement is more difficult. People tend to move in droves. But in the rural areas, it's a bit different. The movement there is essentially to the village markets, to the farms. And of course, people don't go to farms in droves. So what we have done is to marry the restriction of movement to the window provided by the partial lockdown, so that people can still carry on those farming activities that they normally are engaged in. And that's why educators are there to guide them. If you must go to farm, this is the way. If you must go to the markets, this is how. So all of those guidelines are being followed, because we are also sharply aware of the socio-economic implication of all of these. Like I said earlier, part of the subcommittees is the one looking at the economic implications, the numbers, the maths, all right, involved in all of this.
Okay.
So effort is being made to encourage rural farmers to continue to do their work, but observe necessary regulations.
There's been concerns about the palliatives, which
Yes.
has been put together by government. Well, there have been talks along the lines of diversion. There's been talks along the lines of it's not really getting to those who need it. There's been talks along the lines of hijack. What is the response team doing in this regard?
If you listen to the governor's address yesterday, he specifically mentioned that the first stage of distribution of palliatives was not perfect. He specifically mentioned and cited examples of public officers or elected officials who, instead of ensuring that the palliatives got to the most vulnerable amongst us, tended to want to engage in their usual tendency to primitive accumulation and therefore divert this. I can tell you categorically and authoritatively that some of those persons who engage in those sharp practices are going to be arraigned. They have been identified and they will be arraigned. So it's a learning process. Like I have said repeatedly, this pandemic is unique in the sense that no country in the world was prepared for it. As at last night, I was looking at the American situation, over 40,000 deaths.
Yeah.
And they are saying that they haven't attained their peak yet. And they are wrestling with whether to open up the economy or not. Ditto for France, Italy, Spain. You wonder that in Africa, we're already over 1,000 deaths. So those who think that it doesn't affect the black man, it's here already. It's here already. So essentially, in the distribution of palliatives, we're also going to learn. We expect that the second phase will be better handled than the first, and the third will be better handled than the second. So it's going to, it's a collective thing. People who notice sharp practices should be bold enough to point them out. And I must commend civil society, I must commend non-state actors who monitored the movement of these palliatives from the point of release. In fact, they even went to the warehouses where they were kept and ascertained that they were there, followed the movement, tracked them to where they were kept, and tracked the distribution. So kudos to them.
Okay.
So when they notice these sharp practices, please, they should report them to the committee or to any government agencies.
All right, let me thank you very much, Comrade Dustin Sakwe, for availing us your perspectives and trying to ensure we shape the issues so we can make sense of it. Well, thank you again for coming on the program.
Thank you so much.
It's the TMI Monday. We'll take a short break. We've been talking with some academicians. We have in the house Professor Solomon Omosigo. We also have Dr. Mrs. Rachel Okoje. She's an immunologist. And then from Abuja, we'll be talking with a virologist currently working with the National Center for Disease Control. That will be coming up right after this break. Please join us again on TMI.